Hey everybody, have you ever felt like you've had a sinus infection that just won't go away? You've cycled through antibiotics, saline sprays and irrigation, topical medicated sprays, antihistamines, and nothing seems to work? You probably have chronic sinusitis. I'm Dr. Gus, the ENT guy, and today we're going to review what's causing the chronic sinusitis and what we can do to help make it better. Let's start by understanding what are our sinuses. Your sinuses are air-filled spaces that exist behind your cheek, between your eyes, above your forehead, and another set deeper inside your nose. They communicate with the nasal cavity or your nose and drain through very narrow drainage sites into the nasal cavity. When these drainage sites get obstructed from allergies, chronic colds, or nasal irritants, they get blocked, which leads to a buildup of mucus, inflammation, and infection inside these sinuses. This results in the symptoms of nasal congestion or obstruction, sometimes nasal discharge, headache, pressure, and postnasal drip, and in some patients may cause a loss of sense of smell. Let's discuss how we actually diagnose you with chronic sinusitis. The first thing is we have a discussion or a history. I want to know what you feel: pressure, obstruction, headache, discharge. Very important is to know how long this has been going on for, and have there been any other factors that may have caused it? Did you move into a new apartment or house where your allergies have gotten worse? Have you had a kid that's been sick nonstop around you? Or have you put any other different nasal sprays, medicines, or chemicals that are causing inflammation inside your nasal cavity? The next thing we do is examine the head, face, and particularly your nose. How do we do that? I put on a light and use a nasal speculum to look inside your nose. After that, and extremely important, is something that we call a nasal endoscopy. So we spray a little numbing medicine in your nose and use a camera to look inside the nose. This lets me see the drainage area of the sinuses, whether there's something blocking or obstructing them, such as a polyp, if there's active infection or discharge. The third thing that we normally do is we'll order what's called a CT scan or CAT scan of your sinuses. This is a fancy X-ray which lets us see the further inside the sinus area and gives us a map or GPS of your anatomy. Finally, many patients are going to need an allergy test. We use that to determine if you are A, allergic, and B, what exactly you're allergic to, and identify whether you're living around what's causing some of your problems. Let's talk about how we treat your chronic sinusitis. The first step in management is usually what we call medical treatment or medical management. And the most common and pretty simple and easy one that's been around for hundreds of years is saline irrigation. We want you to use a high volume saline rinse bottle or even an neti pot to flush your nasal cavity. That helps clear out any allergens that you're breathing, mucus and infection, and also helps the lining of the hair cells inside your nose to function better. Next, we will commonly prescribe a medical spray. They look like this. The two most common are generally a nasal steroid, such as Flonase or fluticasone, or a nasal antihistamine known as Astepro or azolastine. Really important when you're using these types of nasal sprays, I like to tell my patients that when you're spraying the right side of your nose, use your left hand, and when you're spraying the left side of your nose, use your right hand. Why? I want the tip pointed out and away from your nasal septum, which is the wall that separates the left and right parts of your nose. If not, it can get dry and irritated from the spray being pointed in that direction. Third is we commonly will use antibiotics if we see signs of active infection on your chronic sinusitis workup, which will involve a nasal endoscopy, an examination of your nose, or review of your CAT scan. We put all three of those together along with potentially allergy treatment. There are two forms of allergy treatment. One is an injection under the skin that's generally done weekly, or sublingual or under the tongue drops. And we'll figure that out pending what's going on with your allergy testing results. If you've tried medical therapy and nothing seems to be working, that's when we move to procedures. There's generally two types of procedures that we do to treat your chronic sinusitis. The first is something we call balloon sinus dilation or balloon sinuplasty. That's a procedure that's done in the office, generally takes us about 10 to 15 minutes. And what we are doing is using a small, thin balloon that's placed into the blocked or obstructed sinus drainage area to open, dilate, and alleviate that obstruction. That's done, again, under local anesthesia, takes 10 or 15 minutes, and most patients are able to go back to work the next day. Occasionally, if you're not the ideal candidate for that procedure, the other procedure is what we call functional endoscopic sinus surgery. That is done in the operating room under general anesthesia, where we are removing tissue and sometimes some bone to make a larger drainage area from the sinus. Also, if you have an extensive amount of polyps blocking the area, we will remove those, and if we need to, fix your septum at the same time. That procedure is a little more intensive and requires more recovery time, generally anywhere from 5 to 7 days after the surgery, and is done under general anesthesia.